Hello everyone, welcome to my channel. My name is Heng from Body Emotion Massage and Doula Care. I'm an international board certified lactation consultant, IBCLC, infant body worker, infant massage instructor, and certified doula. I'm also a mentor to teach and train lactation consultant, massage therapists, and doulas. Since 2015, my team and I have served more than 5,000 newborn families in Seattle area. Our practice is inspired by traditional Chinese medicine and Ayurveda. Our specialties are hands-on support. We provide hands-on support. We have great experience in breastfeeding support. We are good at pain management, undersupply and oversupply issues, latch difficulties. Today's workshop, I'm going to show you hands-on breastfeeding techniques for good latch. Let's go. Parents and providers, you can find the handout in the description box. You can find out the handout in the description box. Today's workshop will be 90 minutes. 90 minutes. The first hour, I will divide into two parts, part A and part B. Part A is for expectant parents. You are expecting, so you have time to learn the good latch skills. Part B is for parents who are struggling with breastfeeding or you want to improve breastfeeding experience. The part B is for parents. You are working together with your baby, want to improve the breastfeeding experience. Okay, so there are two parts. And after the 1 hour demonstration, I will spend time to answer your question. Q&A time. Please leave your comments, leave your questions in the live chat box. I will answer your questions. Okay, let's start. Let me show you part A for parents. You are expecting how to feed your baby immediately after birth. You want to learn the skills before birth. When we do something new, we don't have experience, we get so nervous and so panic. So the best is to have a preparation. We learn the hands-on skills, so we know how to feed our baby immediately after birth. I create a prenatal breastfeeding program for parents. Parents learn the hands-on skills, so parents can build confidence before birth. The program is very successful. Many clients give me feedback. They learn the prenatal skills, so they have good pain management. They don't get nipple pain. They learn how to avoid nipple trauma, nipple injury, and they build the confidence to feed baby within the first hour after birth. Okay, so my prenatal training program, including milk ready and body ready part. So this is the number one, milk ready and body ready. Milk ready is for every parent. Believe you have milk. you have milk before birth. Your body started to produce milk when you are pregnant. Your breasts are growing together with your baby. So of course, your body is ready. This is first how to build confidence. I want to make sure parents have the confidence. They know, they truly believe the body is ready for baby. The body has milk before birth. You have milk before birth. Usually this is how I do it. I will teach parents usually after 37, 38 weeks with OBGYNs, with midwives' permission. We can practice the hand expression techniques. When we practice the hand expression techniques, mom put hands on her own breast and remove colostrum. Every time when a mom sees the colostrum coming out on the top of the nipple, every mom gets so excited. Wow, I'm so happy. I have milk. I'm ready to feed my baby. So this is a process to build confidence. Milk is ready before birth. Milk is producing when you are pregnant. So before birth, we practice hand expression with OBGYN and midwives permission. We can practice usually after 37 or 38 weeks. So this is a practice, hand expression. Let me show you the technique, hand expression. You put one hand to support your breast, one hand support your breast, and another hand use your thumb and index finger on the areola area. Yeah, you can be a little bit closer, you can be a little bit wider. It depends on you, how you feel you can apply pressure on your breast, on the areola area. Yeah, and you can tell the thumb and index finger a straight line with the nipple. Nipple is in the middle. So the 3 point are straight line. And the first step, you use 2 fingers, press down towards the rib cage. Press down. Yeah, the pressure is downward. And compress 2 fingers together. See, your 2 fingers press down first, you hold it and compress. Press down, compress. Press down, compress. 2 fingers are together. You can change different position, different spot, and find out where is your sweet spot. Okay, so this is the hand expression for colostrum. You truly believe you have milk before birth. When baby is born, your body is ready to feed your baby. And the next, I also teach my clients to learn the hands-on techniques. Let your body ready. Usually a newborn baby is around 6-7 pounds. If in your whole life you may not have too much time to hold something 6 or 7 pounds consistently. So before birth, that's a good time, good exercise. You can use the toy, you can use the doll to practice how to hold a baby. So then we can see on our handout. Number 2, tools. What tools you can use to practice? You can use a doll, you can use a toy, teddy bear toy to practice. Yeah, how to hold the baby. Use a doll, how to hold the baby. Yeah, you can hold baby. And how to hold the baby is important. In order to give baby a good support baby's head, we use C-shape. Open, support baby's neck. Support baby's neck. This is how you support baby's neck. And many parents are so worried about baby's head. Is heavy without support. So parents hold the back of the head. When you hold the back of the head, see, baby's chin tuck. When baby's chin tuck, that's difficult to open mouth widely. So when you hold the newborn, support. When we say, hey mom, hey dad, support baby's head where your hand is. Your hand is on baby's neck and upper back. Neck and upper back. C shape. And where your thumb and index finger are, behind the ear, behind baby's ear. This is a support spot, how you support baby's head. When you support baby's head, your hand is not on baby's head. Your hand is on baby's neck and upper back. Use a toy to practice how to hold your baby. C shape, C shape. See, I use this silicone doll to demonstrate. When I hold baby's head, baby is chin tuck. Baby feels the pressure on the head. Okay, chin tuck. That's difficult to open mouth widely. Now I change my hand position. My hand supports baby's neck. See? Support baby's neck. Baby feel, wow, there is good support. So I feel safe. I feel comfortable to go back. My head go backward. Tilt up my head. Even this silicone baby, see, you can see when back, tilt up. The mouth naturally open wider. The mouth naturally open wider. Okay? So this is how you can practice before birth. We call this is body ready. Parents body ready for breastfeeding. And our muscles, your baby's muscles have memories. You practice, you repeat, you will do it better. Practice, make it perfect. Okay, this is how you can practice with the doll toy. And I also want to show you a water bottle. Water bottle is also a good tool. Yeah, this water bottle, the opening is very similar as baby's mouth size. So you can get the idea. How to position my breast inside. How to position my breast inside baby's mouth. And later I can show you how use this water bottle to practice. Okay, so this is the tool you can practice. Use a doll and water box. And number three, skin to skin. Skin to skin. Okay, so once baby is born, nurse will bring baby to you. This is a good time, good time to practice skin to skin contact. Skin to skin contact. Let your baby's chest on your chest directly. Skin to skin contact. Okay, congratulations, mom. You and your baby did a wonderful job together. Baby is so happy. Baby is so safe. And both of you are doing good. Yeah, the skin to skin time is valuable. You use this time to relax. Yeah, and encourage yourself. I did a good job. I'm so proud of myself. I'm going to rest a little bit. No hurry. You feel you are ready. Then you can start to have the first feeding, the initial latch. No hurry. And the first breastfeeding session may take 1 to 3 hours. That's normal. Okay, so skin to skin, your baby's chest. There is nothing, no clothes, no swaddle between you and your baby. Skin to skin directly. Yeah. When you do the skin to skin directly, you rest. Yeah. Baby's head turn to both sides. Okay, we can practice turn to left side. Yeah. When we help baby to turn the head left side, you use the same technique. C shape on baby's neck. Gently help turn left side. And you can use another hand, turn baby to the right side. This is the technique. Yeah, you support baby's head on baby's neck. Yeah, behind and below the ear spot. When baby turn to the left side, turn to the right side, that's the preparation, that's the practice. Yeah, later, baby latch on your breast. Yeah. Help baby to, when you are doing the gentle touch, the skin to skin, you do some gentle touch. Okay, baby learn practice. The head to one side, head to another side. This is to loosen up the tension on baby's neck. Yeah, think about that. When your baby is inside your body, all the joints folded. And in order to latch well, baby need to open the body, open the chest, open the joints, and the head. Yeah, open. Yeah. So this is practice. Turn to the left side, turn to the right side, and you can use gentle touch, massage baby's back. That's a good stimulation for nervous system. Massage the back. Yeah. Massage baby's back. Every time you massage baby's back, if baby arch the back, that's good stimulation. Activate the nervous system. That's the preparation for latch later. Okay, so this skin to skin is good preparation. Take your time, rest, do back, gentle stimulation, and help baby to move the head a little bit. Yeah, move the head a little bit. Turn to the left side, turn to the right side. Preparation for latch. When you see baby start to open mouth and the tongue start to stick out, that's a sign. Yeah, you can try. Yeah, you can try to latch your baby. You can try to put your baby on the breast. Yeah, we take time. And first, we learn how to hold the breast. Earlier, we learned how to hold baby. We support baby's neck and baby is on the chest. This is a good position. Yeah, this is a good position. And how to hold your breast. Now let's go to the handout number 4. We learn what is sandwich hold. Sandwich hold may be easier for your baby to latch deeper and hold more breast tissue. Think about when you are eating sandwich. The sandwich is thick. Yeah, it's difficult to have a big bite. Yeah, sandwich is so thick. So how you eat sandwich easier for you? You make the sandwich flat. Yeah, make a sandwich flat. Yeah, and have a big bite. That's easier to have a big bite. When the sandwich is flat, easier for you to have a bite. The same as the baby. If you use your hand to help your baby, use your hand to make your breast flat, easier for baby to have a deeper latch. So sandwich hold. We hold baby's neck, support baby's neck, and do the U-shape sandwich hold. We watch where baby mouth is. See, when my mouth is this way, I make it flat. This we call this is U-shape. If I make the sandwich this way, if I do the U-shape and face to the sandwich, that will be more difficult for me to have a big bite. So this is a C shape, make it flat. This is a good position for me to have a big bite. And this is the U shape. The U shape will make the bite more difficult because even more thick. So C shape, U shape, C shape, U shape. And when we should use C shape, when we should use U shape, depends on different positions. Okay, the first feeding after birth. I'm showing you the easiest way. The easiest way is baby's belly on your belly. Biological position, that is the easiest way. Okay, we do the C shape. And knit baby's chin on the breast, and have a good latch. Later on, you will want to know, hi Heng, I know how to hold my breast. You mentioned C shape, and you also mentioned how to hold baby's neck. I just don't know how to put them together. Later, I will show you the technique, how to put together. C shape, make the breast flat, and do the latch. When baby open mouth widely. Later, show you how to put together. Okay, and then I'm going to talk about the number 5, pain-free. I would like all parents believe that breastfeeding should be pain-free. If the latch is painful, something is wrong. You should stop. Don't hold the pain. Don't sacrifice the pain. Breastfeeding should be relaxed, and breastfeeding should be enjoyable, and you really enjoy it. If you hold the pain, what may happen? You may have nipple injury, you may have nipple trauma, and your baby may not be able to remove sufficient milk from your breast because the latch is shallow. When the latch is shallow, your baby may not be able to stimulate late dance. So moms, please remember breastfeeding should be pain-free. This is a body-ready part in my program. I want every mom remember breastfeeding should be pain-free. When there is pain, you must stop. You must protect your nipples. And when your nipples are injured, you are in pain, and your body may not get the signal to release sufficient oxytocin. That may impact your supply. Also, the nipples are the exit. The milk go out Yeah, through the nipple. So if there are injuries, there are swallow, that means maybe this exit, this door maybe become narrow. Yeah, more difficult for the milk flow. So protect your nipple is very important, very important. Breastfeeding should be pain-free. Now we learn number six, asymmetric latch. Asymmetric latch. I will use tool to explain to you asymmetric latch. And the asymmetric latch is the important skill. I will show you how to put breast and baby together. This is a teaching tool. You can imagine this round container is your baby's mouth. The round container is baby's mouth, and this is your nipple. Yeah, this is your nipple. The moment you put together, mouth, nipple, the moment you put together, it's not plug. It's not like you charge, you plug together. Yeah. So the nipple point up, gentle slide inside, gentle slide inside. So the nipple is on the opposite side. The nipple is on the upper side. Reach the roof of the mouth. The nipple is on the upper side. Why the nipple should be on the upper side? See, the nipple is on the upper side. Then tongue, baby's tongue will have space to move up and down. The tongue will have space to move up and down like a wave motion, Say, for example, if I want to talk to you, my tongue stick out just to get ready to talk to you. Then something coming out. Okay, then blocks the movement, blocks the motion of the tongue. Okay, I just stick out my tongue, something come in the middle. Okay, my tongue have to retract. So the moment you put together nipple and baby's mouth together, the nipple is on top. Not in the middle. See, the tongue is in the middle. When you put your nipple in the middle, I saw that happen a lot. Parents say, hey, my baby open mouth so widely. Let's do it. It's not plug. Not plug your nipple inside baby's mouth. When you put the nipple in the middle, the tongue retract. Tongue just stick out, going to work, going to move like a wave. You put the nipple in the middle, tongue doesn't have space to move. So the tongue retract. So this is a technique. Asymmetric. The nipple should go top and reach the roof of the mouth. Now I'm going to use another glass to show you. This is the breast. Okay, when you put together, it's not plug inside in the middle. Okay, and nipple point up. Point up towards baby's nose. Let baby's chin on the breast first. Nipple reach the roof of the mouth. So there will be space for baby's tongue to move up and down. The tongue will have space move up and down like a wave. So this is asymmetric latch. asymmetric latch. Okay, the nipple on top, the nipple on top. Now, you may have a question. Hi, Heng. How a baby can remove milk from my breast? I want to know more. How a baby remove milk from the breast? First, baby use the mouth 360 degree. The mouth 360 degree, fully seal on your breast. Fully seal on your breast and start to suck. This is negative pressure, similar as you use the pump and vacuum pressure, okay? And this is negative pressure, but it's not enough. There is positive pressure. What is positive pressure? Positive pressure is similar as when you squeeze the toothpaste, that's positive pressure. So when baby use the lips fully seal on your breast and baby's chin, cheek, jaw on your breast, and apply compression. The compression is positive pressure. This is from the outside of the mouth. The inside of the mouth, baby's tongue. The tongue is powerful. The tongue pull the areola and nipple area, pull the nipple in the deeper spot, make it closer to the throat. Yeah, closer to the throat, and move like a wave, apply compression on your breast. That's also positive pressure. So baby apply negative pressure and positive pressure to remove milk on your breast. So if the tongue is not able to move, baby is not able to apply wave like motion, baby may not be able to stimulate it down. Baby may not be able to transfer sufficient milk from your breast. So we see asymmetric latch. Now I'm going to demonstrate, use my own face, own tongue to show you how to stimulate the latch. Okay, from the side, you make a sandwich hold, and the nipple point up. Yeah, of course, you support baby's neck and baby's head. Chill up. Stimulation from the nose to the chin. Usually baby don't know where to go, so baby move. Baby move, and you use the chin. The chin is the first point. Baby reach your breast. Let baby's chin reach your breast first. You use this to point where to go, point the direction for your baby. And the moment your breast on baby's chin, gentle pull down the chin a little bit. See, this is very, very fast movement. Gently pull down the chin, and the nipple slide into baby's mouth from the upper lip. Yeah, let me do it one more time. Support baby's neck. Stimulate the suction reflex. Baby is looking for milk. Baby don't know where to go. Use the chin point on your breast. And the moment, gentle pull down. And the nipple slide So this is the latch technique. I call it a rolling technique. So the chin, the bottom nip, upper nip. Roll your breast inside baby's mouth. 3 points. The chin on the breast first. Then the second place will be the bottom nip. And the last one will be the upper nip. Yeah. 1, 2, 3. 1, 2, 3. Yeah. Stimulation. Yeah. One more time. One more time. Stimulation. Yeah. So that's the 3 point. 1, 2, 3. The asymmetric latch. So parents, you are expecting you can learn these techniques. Yeah. What you can learn, you can use. You can use a balloon or your own breast. Yeah. Use a water bottle. Yeah, this is a practicing tool. You can use the water bottle to practice before birth. Okay, so let baby's mouth on the breast first and nipple snag in. Nipple snag in. Nipple snag in. Nipple snag in. You can use water bottle to practice a little bit so you understand it's not plug. It's not plug. See, when you plug your nipple inside baby's mouth, first tongue don't have space, and baby naturally use the gum, upper gum. Naturally use the gum. You put in the middle, naturally use gum, chop your nipple. So the technique, asymmetric latch. The nipple should point up. Nipple should point up. Okay, this is the part A for expectant parents. You can learn these hands-on techniques. Remember, breastfeeding should be pain-free, and practice these techniques before birth with some practicing tools, a doll, a toy, and the water bottle, some cup, to practice, get the idea. It's asymmetric latch, and the latch should be pain-free. Okay, then we're going to the part B. Part B, parents, you are struggling with breastfeeding. Baby's latch is shallow. Baby cannot get deep latch. You need to train your baby. How we can train a baby? We use hands. We use hands to train our baby. Yeah, especially when a baby is comfortable with a bottle, baby try to use the same technique. Baby try to use the same technique to latch on your breast. Baby get frustrated. I'm confused. On the bread, on the bottle, I can get milk easily, but on the breast, I chop. Yeah, I chop the teat. I'm not able to get the milk. Why? Yeah, because that's different techniques, different body mechanics. Yeah, so we can use some massage techniques to teach baby how to reuse the muscle, train baby how to use the muscle. Okay, and so number one, we can check the breast. That's the breast palpation techniques. Yeah, why we want to do breast palpation? When we put baby on the breast together, if a breast is soft and the flow is easier, that will be helpful. baby feel, oh, it's so easy to remove milk. So first we want to make sure the breast is soft. When the breast is soft, easier for baby to latch deeper and hold more areola area. Yeah. So how to make it soft? Yeah. How to make it soft? The 3 fingers on top of the nipple and areola area. Sink. The first step, sink. You use a finger pad to sink, 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 and you feel some firm spot and gentle roll. Gentle roll. Yeah. And all the direction. Yeah. Gentle roll, gentle roll. You make the areola area soft. That will be easier for baby to latch. Imagine you use one hand to grab firm basketball. Yeah, the basketball is full of air inside, so hard, yeah, so firm. You feel difficult to use one hand grab that basketball. But when the basketball is soft, that will be easier for you to use one hand to grab that soft basketball. So it's similar. If the areola area is soft, that will be easier to draw the breast tissue in the deeper spot of the mouth and have a deeper latch. So we want to make sure the areola area is soft. Yeah. And we make it soft, and we can also do the hand expression to check the flow. Hand expression to check the flow, make the areola area is soft. Yeah, the flow. Yeah. Baby may like sometimes fast flow. Baby is not able to handle that, or some baby like faster flow, some baby like slower flow. So baby choose what she like, what he like. Yeah, so we want to make sure the flow is easier. Yeah, is easier for your baby. Some mom has low milk supply issue. So, and baby is very comfortable with the bottle feeding, so the flow on the breast may be slow for a baby. Then we can do something to stimulate the letdowns and increase the milk supply. Yeah, and some moms, they have fast flow. Yeah, some moms tell me, my supply is so good. I have oversupply. When mom has oversupply for baby may feel overwhelmed. Baby feel, okay, on the bottle, I can control the flow easily. If I don't want the extra milk, I just use my gun. Yeah, to hold the teat, I can block the flow. I can control. I feel safe. But when a mom's flow is very fast, the baby feel, oh, I'm facing a shower head, the milk coming on my face. So we will help to reduce the speed of the flow, and may help mom to reduce some milk production. Okay, so we make the flow easier for baby. We make the breast soft for baby. That will help with the latch. Then the second, number 2 technique, we teach baby how to latch. Yeah, when baby cannot latch well, why? Because baby don't know how to use these muscles. Baby don't know. Yeah, baby, if baby's neck is stiff, baby's neck is stiff, baby is not able to tilt up the head. So we can do some neck massage. Yeah, the side, both side, and the back of the neck to loosen up the muscles. Yeah, in order to latch, we want the neck muscles are relaxed. Parents, now you can try to do this motion together with me. Yeah, in order to latch baby's head to your back. Yeah, to your back, and the chest need to open. Yeah, chest need to open. See, when you move your head backward and open your chest, what you feel? You can feel, okay, you can feel the back, your spine arch, okay? You can feel the back is arch. And what happened on your hips? You have to lift your hip a little bit, right? In order to tilt back your head. Tilt back your head. So that's all, yeah, it's a full body work for baby. The neck, tilt back, yeah. And the back arch and the hip, baby's hip. Baby need to lift the hip a little bit, raise the hip a little bit. So we do the neck massage, loosen up the tension, and the chest. Yeah, open up the chest. That's a massage technique we can do. Okay, open up the chest. This is a massage, help baby to open up the chest. And how to help baby to lift the hip. Tummy time. Tummy time is a good exercise for baby. Yeah, baby do the tummy time will arch the back and learn how to lift the hip a little bit. Yeah, so that's good exercise. You use massage, you use tummy time to teach baby how to move the body. When a baby is learning how to latch, it takes time. It's a learning process. We teach baby how to move the different parts of the body first, how to do some movements. Yeah, if baby is not able to tilt up the neck, baby cannot do the good and deep latch, then not in a hurry to put baby on the breast, to give baby too much pressure to latch on your breast. Let's try to practice the movements first. Yeah. So when baby start to move the head backward and can open mouth widely, that's a good timing. Then we can practice deep latch more, practice on the breast more. So some parents, they really want baby to latch, and baby cry, baby struggling on the breast, and baby may have some memories. Every time on the breast, I feel so stressful. I'm struggling. Yeah, I'm struggling. So baby don't want to practice latch. So we don't force baby. If baby is learning, baby is struggling to do some movements, we teach movements first. Okay, neck, tilt back, chest, open. Yeah. So if your baby's chest always this way, because that's how your baby stay inside your body. Yeah, the chest. Yeah, get together. We want to open, learn the movements first. Lift the hip, baby learn how to lift the hip, how to raise the hip a little bit. Yeah, try these massage techniques. Then we want to do the face. Yeah, how to massage baby's face. If the face, see this muscle, facial muscles and facial nerve tight. Yeah, baby may feel, so tight, I'm not able to open mouth so wide because so tight. So we do the facial massage. Facial massage, easy, 2 or 3 fingers on your baby's face, clockwise, counterclockwise. Yeah, we do the facial massage. Then, very important, how to massage baby's tongue. Yeah, usually baby is not able to have a deep latch, shallow latch, or baby is learning how to swallow better. Yeah, baby's tongue, yeah, the muscles may be weak, or baby don't know. I don't know how to move my tongue. Yeah, I just don't know, because with bottle, my tongue don't need to move too much. I just naturally use my gum, compress the teeth of the bottle. I can get milk. I really don't know how to move my tongue. So we use our hand teach baby how to move the tongue. I will use my own tongue to demonstrate. When we visit clients, we usually wear gloves. Yeah, wear glove and do oral exercise assessment. And for parents, when you do it for your own baby, you don't have to wear the glove. Skin to skin is always the best. You just need to trim your nail, make sure no nail polish, and wash your hands really good. Yeah, then you can do the oral exercise without glove. Okay, so when we do the tongue massage, we start to tap the muscles on the lips. Do some stretch, yeah, on the lips. We don't force to put finger inside baby's mouth. Yeah, we tap, and baby so happy. Look at you, baby feel, oh, this is a game. Mom is playing with me. Entertainment, fun. Yeah, baby start to open mouth, and the tongue start to stick out. That's the timing you put your finger inside. And one side of the tongue, do some massage. Another side, that's a stimulation. Okay, and I want to point the middle part of the tongue. The middle part of the tongue need to elevate to stabilize your nipple in the deeper spot, which is closer to baby's throat. So the lifting motion of the tongue is very important. The middle part. So how to teach baby to lift? Hey, baby, you need to lift your tongue. You need to lift the tongue. Your finger on top of the middle part of the tongue and gentle press down. Every time when you gently press down, baby feel the pressure. Baby elevate the tongue. You press down, baby elevate the tongue. Do 3 times. Yeah, before feeding. 1, 2, 3. Yeah. Of course, when you do it, you keep the finger inside baby's mouth. Yeah, 3 times. Yeah. This is exercise. Yeah. Baby learn how to use the middle part of the tongue. Baby learn how to use the middle part of the tongue. Baby may stick out the tongue more often. Yeah, and help to have a deeper latch. And another exercise, you use your thumb. The finger pad touch the roof of baby's mouth. Let baby's tongue wrap your thumb and start to suck. You can see baby's tongue start to move. Yeah, move. Stick out, inside, outside. That's a good exercise. Yeah, and you can feel baby use a tongue wrap your finger. Wow, baby use tongue massage my finger. I feel so good. Then you do the exercise. Try to pull the chin down. Let baby's tongue work independently. Baby use the tongue, wrap your thumb. That's an exercise. Yeah, build the strength. Baby just use the tongue muscle to wrap your thumb. Yeah, so baby will not compensate the jaw, the muscle or the jaw to hold your thumb. This is a good exercise to strengthen the tongue muscle. Yeah, we learned massage the left side, right side, middle part, gentle press down, and the suction training. Suction training, put the chin down. Yeah, put the chin down. And we can also do the underneath the tongue. Underneath tongue, so baby is able to elevate the tongue. If the tissue underneath the tongue is tight, baby is not able to elevate the tongue, move like a wave. So this is how you can do it. Gentle sweep underneath the tongue. 3 times. And the floor of the tongue, left side and right side. Three circles. So this exercise, you use your hands. Your hands are the best tool. You use your hands to teach your baby how to move the body, how to move the neck, how to open up the chest, and how to lift, raise the hips, and how to relax the facial muscle, how to move the tongue and build the strength. And if your baby has the strength, have the techniques and skills, to hold your fingers, you can feel okay. Before, every time I put my finger inside baby my mouth, baby always use a gum to chop my finger, and the same chop, or bite my nipple. Gradually, the more you do the exercise, you feel, hey, baby learn how to use the tongue. I can feel the tongue is strong. And baby use the muscle strength instead of the joints, instead of the bone. The bone pressure on my finger. Then you feel that's the progress. Baby may learn well on the breast. So that's the massage, that's the infant body work, exercise and stretch for your baby to learn the techniques. Then we can go to the number 3, training with bottle feeding and cup feeding. And parents, I know breastfeeding can be struggling. You really want your baby to latch, but baby is struggling. Baby is not able to transfer enough milk from your breast. We still need to feed baby. You still have the stress to feed your baby. Okay, so when we use bottle to feed baby, we still want baby learn the techniques, learn how to move the body. Okay, so you can try the side lying position with the bottle. With the bottle, and we control the speed. The milk is halfway, and we watch baby. When baby suck, we give milk to baby. Milk is never full. Baby, milk is not full in the teat. Baby is sucking, we offer milk, and baby pause, we drop a little bit. So this way baby learn, baby remember. Babies can be very smart. They remember. The muscles have memories. Baby gradually remember from the bottle. Oh, I suck, I get milk. I don't suck, I don't get milk. It's seminar on the breast. Yeah, when baby stimulate the breast, baby can get milk, baby can get let down. So sometimes there is milk, sometimes there is no milk. Yeah, so you can use a past bottle feeding. We call this is past bottle feeding method to teach baby how the techniques. Okay, I need to work for milk. Side lying, yeah, you can use this way to feed your baby. Side lying, feed your baby, or you can put your baby on your lap, left side and right side. The side lying, because most positions, baby is side lying, sideways on your breast. So you practice the side lying past bottle feeding method. You control the speed to use bottle feeding for your baby. Okay, and next I want to talk about cup feeding. I talked to many lactation specialists in Asia, in India, in China. Some mom really want to transfer baby from bottle feeding to breastfeeding. Yeah, what is a good method we can do? Yeah, especially in India, there are special baby feeding cup. Yeah, special baby feeding cup to feed baby. In India, usually a pediatrician will suggest if baby is still learning how to latch, we can use this baby feeding cup. The name is Palade, baby feeding cup, to teach a baby how to move the body, how to move the tongue. And we can use a spoon or we can use a cup to teach baby how to move the body. And when we use a spoon and a cup to teach baby, also it's a training process. Yeah, training process. It's not just simply you bring the milk to baby's mouth and baby get fed. It's a training process. I will demonstrate how to use a spoon, or cup to feed a baby. Earlier, I mentioned there are two pressure when baby remove milk from breast: positive pressure and negative pressure. So similar, when we use a cup to teach a baby the skills, we need baby practice both positive pressure and negative pressure. First, I show you the easier way how to apply negative pressure. Baby learn how to suck. Okay, so you press the edge of the cup on top of baby's tongue and let the surface of the milk touch baby's upper lip. So baby learn how to suck. The cup is horizontal. Let baby do the work. You don't pour the milk inside the baby's mouth. Yeah. Let baby learn. See this technique, the edge of the cup is on top of baby's tongue. Baby learn the vacuum pressure, how to suck, get the milk. Yeah, the surface of the milk touch baby's upper lip. Baby learn how to suck. And then another pressure is positive pressure. How to train the baby learn positive pressure and move the tongue like a wave. Think of it like a little dog. How a little dog drink water from a container. let baby's tongue lap the milk. Let the baby's tongue lap the milk. Yeah. So this training way, we position the edge of the cup underneath the tongue. So let the tongue stick out and lap the milk. So parents practice both methods to feed your baby. Cup feeding on top of the tongue and underneath the tongue. Your baby can learn positive pressure and negative pressure. That's the similar techniques on your breast. During this process, we need to be very patient and confident. You just have the belief. You believe yourself, you believe your baby. You can work together as a team to achieve your feeding goal. And at the same time, we don't want to make you and your baby feel too stressful. We don't force a baby to latch on your breast. If you feel tired, you are worried, you can always use a bottle. Side lying, paste a bottle feeding method to feed your baby. And sometimes you have more energy, you have more time, you can use the cup. Practice the negative pressure and positive pressure method. Let baby learn the techniques, and gradually we transfer from the cup feeding to breastfeeding. And in my practice, we got a lot successful case. Moms transfer bottle feeding to cup feeding, then breastfeeding successfully. If you need help, please feel free to call me, text me. I can visit you and I can teach you. I will show you step by step. I will hold your hands and show you what is the right angle, what is the right spot to guide your baby to achieve your breastfeeding goals. Okay, thank you so much. And we talk about part A and talk about part B. And I know there are a lot information and a lot techniques. You may take time to process. You can always, we keep this link available. You can always replay and watch the videos again. And feel free to reach out to me if you have any question or you need home visits to teach you how to have a good latch. I'm happy to help. Now it's the time. I'm happy to answer your questions. Q&A time. Please type your question in the chat box. I'm happy to answer your questions. Any question about the latch, about the infant body work, about the training? What are the cups called and how do I purchase them? Okay, so there are many different cups. This is a feeding cup, soft. This is glass cup. You can find baby feeding cup, small, and you can order the cups from Amazon. I think there are a lot of choice. Small cups. You don't have to get special cup. Any small cup, small bowl. And you feel easy to use. you can get. And I can send you a link, some cups we are using, and I will text you the link. Okay, thank you. Next question. Hello, I had my baby 4 days ago and currently triple feeding, and nurse and pump and supplement with bottle. I think baby is having nipple confusion. How to quickly get over that? Yeah, and so right now baby is 4 days old. Usually that's the time your body start to produce more milk. There is one way we can make the feeding session more efficiently. Makes the feeding session more efficiently. When you use one position to feed your baby, let's say football position, or cradle position, or layback position. Usually a let down lasts less than 3 minutes. Let down lasts less than 3 minutes. So you can try when baby suck, swallow, that means there are let downs. Baby help you to turn on the milk faucet. When baby slow down, it's a sign for you. Okay, the let downs stop. There will be a gap, and baby may be waiting. Then you switch to another breast. For newborn baby, it's a learning process. Baby don't know, okay, when there is no milk, I keep sucking, I can get milk again. Newborn take time to figure out that. So one side, 3 to 5 minutes, then you switch to another side. When you switch to another side, use our technique. Part B, the number 1, breast palpation skill makes the areola area soft, and hand expression to check the flow, let the flow coming out, and switch to another side. So change sides, and every time when you put baby on your breast, you use your finger to stimulate the let downs. You use your finger, help the baby to get milk. I call this is baby food delivery service. You help your baby to deliver milk, and baby feel, oh, it's so easy. When I'm on the breast, there is always milk. I don't have to work too much. Okay, and baby work harder. And the more baby work harder, baby feel, ooh, the more I suck, more milk I can get. And gradually your baby will get sufficient milk just from your breast. You may not have to pump. You may not have to supplement with bottle. And I suggest you to practice the Latch techniques, and you have a lot of potential. Baby 4 days old, both you and your baby are learning together how to work better, and I'm sure both of you can learn very well. So I think the techniques, change sides, and you use your hands to stimulate the let downs will be a good way. Save time, save energy for both you and your baby. And I'm happy to visit you if you need in-person help. Okay, thank you. Yeah, that's fine. I use the Event Philip bottle with slow flow nipple. That's fine. Yeah, you can choose. Yeah, you can choose the any bottle you feel it's working for you and your baby. Okay, thank you. Next question. People nurse at hospital, pediatric dentists, lactation consultants tell me that my baby has tongue tie that affects feeding. What's your view of cutting tie versus using techniques to help baby first? Okay, so I want to say there is no there is no standard, okay, when we must do the procedure. So we usually look for appearance, and we do assessment to find out, okay, baby's tongue's function, any symptoms, any symptoms. So, and there are something may negative impact baby's latch. Baby's body is intense, or moms and babies can't figure out how to work with each other perfectly. So I would say the massage will be helpful, and good position, good attachment techniques will be helpful. The tongue-tie release procedure is the last choice. We try everything. I can tell the latch, the hands-on techniques are so good, and baby is trying so hard. Baby's neck, wow, perfectly angled. Baby open chest, baby lift the hips. Everything is so good, and my baby is trying so hard. Try to have a deep latch, and baby is struggling because something hold baby's tongue. And that's the only reason. That's the tongue-tie issue. That's the only reason stop my baby to have a deep latch. Then parents may consider a procedure. And I always say that's the personal choice. That's a personal choice. And parents, you feel you are mentally ready, you are physically ready, then you consider that procedure. I don't recommend when parents feel, okay, I'm struggling with breastfeeding, then immediately, directly, I go to do the procedure. The procedure should be the last choice. You try everything, it didn't work out, then you consider the procedure. Okay, thank you. And appreciate the response. How can I book a consultation call with you? Please feel free to call or text me at 425-208-6232. I will type my phone number. I will type my phone number. Thank you. And I can do a phone consultation, and I can also visit you. I believe the hands-on support is more efficiently, more helpful. Okay, thank you. Next question. Baby is 4 weeks old, and he gets very stressed at birth, fast let down, and trouble swallowing. I believe the fast let downs, as I mentioned in our handouts, number 1, breast palpation technique. First, we want to make sure the breast is soft, and when the flow is fast, you may try the lay-back position. When you do the lay-back position, the gravity may make the flow, is not so fast. The flow, the pressure or the speed slow down to shoot out. So the layback position may be good. And the side lying position may be good for fast flow. And I also want to share another thing. when we use the high pressure gun, high pressure washing machine, high pressure washing gun to wash, we can feel the pressure is so high. So on our breasts, there are milk ducts. If they are narrow, you have good milk supply, you have oversupply. When the milk ducts, the space narrow, the pressure inside the breast is high. So with narrow space, the milk shoot out. In traditional Chinese medicine, we believe we need to do some lactation massage to clear the milk ducts and make the flow is easier, to reduce the tension, reduce the pressure inside the breast. So the milk will not shoot out like a fountain because the pressure inside is high. That will help for fast flow moms and baby. When baby faced to the fast flow, baby feels the pressure is too high and too difficult to handle. That's the traditional Chinese practice for breastfeeding support. We do lactation massage to regulate the flow. If the flow is slow, we can do massage to open up the channel, make the space more and more milk flow to increase supply. And for fast flow, usually mom have fast flow, may have milk stasis, may have clogged ducts, and makes the space narrow. When the space is narrow or the fascia inside the breast is tight, the pressure inside is high, so milk shoot out. Baby have hard time to handle that. If I have a chance to visit you, I can also give you lactation massage. That may be helpful. Okay, so we currently live in Vancouver, BC, not in Seattle. Are you able to visit Vancouver, BC? I may help you to find out, who may be able to practice the hands-on techniques, the traditional Chinese lactation massage techniques, and help you with that. Or we can do one-on-one consultation. I will show you the detailed techniques, how to do it by yourself. Okay, thank you. Any pumping tips to increase supply in the initial weeks to stop supplementation quickly? Currently use Medela hand pump to pump right after nursing. You may consider Medela electric pump, use both sides. The hand pump, generally speaking, because everybody is different, and the best is to try to find out which one is the best match for you. Generally speaking, the electric pump on both sides are working better. And luckily last week I have a training workshop to share all the pumping techniques. You can find the workshop last week. How to max your milk supply through pumping. You can find the 90 minutes workshop, and you learn some techniques, how to get more milk from pump. And usually parents feel the Medela Symphony, the high-speed grade pump work well, and the Spectra S1, that pump also work very well. You can try if it's a good match for you. And the basic use of pump. A pump should be pain-free. You should not feel pain from pump. If the pump make you feel pain, discomfort, that's not a good pump for you. And thank you. Next question. The Medina Hospital grade electric pump. Yes, the name is Medina Symphony. You can rent from hospital. You can rent it from hospital. If you have your insurance cover the breast pump, you can also try to get Spectra S1 is also a good pump. And in my last workshop video, I talk about how to find the good flange. Yeah, the flange also matters. The size of the flange, the shape of the flange, and the texture of the flange also may impact your supply. And for me personally, I believe your baby is your best your best choice to help you to increase supply. Try to work with lactation specialist to improve baby's latch and teach your baby to remove more milk from your breast efficiently. That's the best way to increase your supply. You have milk and trust yourself. You have milk. We just need to teach baby how to transfer milk and remove milk from your breast. Yeah. Yes. Okay, so the pumping workshop, that's from the last week. Great. Thank you. And so for the next week, our workshop, I would love to teach parents how to make comfortable breastfeeding positions, how to do hands-free breastfeeding. Any breastfeeding position you can do hands-free. You don't have to hold your baby during the breastfeeding session. Yeah, you can do hands-free. When you do football position, you can do hands-free. You can watch TV. Yeah, you don't have to hold your baby. Yeah, during the feeding session. When you do the cross cradle position, you don't have to hold your baby. And you can do side lying position, hands-free. You can do laid back position, hands-free. That's the training to train your baby hold you instead of you hold your baby. You want to train your baby to work actively on your breast. So that's the techniques I'm going to teach you next week. So for some parents, you may have seen little puppies and little kittens. When little puppies and kittens get milk from the dog or the cat mother, the mothers usually lie down on the ground, and puppies and kittens get milk from mom's body. So we can train our baby to get milk. Yeah, to get milk on your breast. We teach your baby to keep balance on your breast. So you don't have to hold your baby, during the 20 minutes feeding or 30 minutes feeding sessions. When we first position baby on the breast and get a good attachment on the breast, baby start to suck, then our hands start to move. Hands-free breastfeeding. I will share the links. And for the next week's breastfeeding online live workshop. And all providers and parents, thank you so much for spending time with me. Thank you so much to join this workshop. If you are interested to join us, we have support group. We have WhatsApp support group. If you are interested to join us, the parents support group, we ask questions. Yeah, we share information, we support each other. That's for parents. And as a mentor, I also have a provider WhatsApp group. As provider, we talk about how to support clients better, how to learn from each other. So if you are parents, you want to join the WhatsApp group, you are a provider, want to join the WhatsApp group, please feel free to text me or call me. I will add you into our WhatsApp group so we can learn more from each other. If you want to book online appointment or schedule a home visit, please feel free to call or text me or check my website. I'm happy to help you. Breastfeeding support and postpartum support is my passion. So I'm so lucky. I'm so happy I can work with my passion and I can help more families and babies. Thank you so much. My name is Heng from Body Enmotion Massage and Doula. I hope to see you next week. And you can save this video link and replay and watch. And I'm looking forward to your feedback. Please let me know how you feel. And these techniques, these skills, are they working for you? Yeah, and I would love to hear from you. Thank you so much. Thanks for your support. I will see you next week. Yeah, take care. Bye.